Generic drugs are so important right now because we're in a difficult economic situation in our country, and individuals are stressed economically. And what generic medicines bring are strong health and medicines that patients need, but at a significant savings to both the individual patient and to our healthcare system in total. Last year, 2019, 90% of the prescriptions filled in this country were for generic medications, but they only accounted for 20% of the overall spend on pharmaceuticals. So 9 out of 10 prescriptions are written for generic medicines, but only 20% of the cost. So that's a significant savings, which added up to $313 billion in savings to our system last year alone. American patients succeed when generic drugs succeed, and that is when the patient goes to the pharmacy counter. If you bring a prescription to a pharmacy counter for a brand name drug, the average copay on that medicine is around $60. If you go to the pharmacy counter with a prescription for a generic medication, the average copay is $6. So right there is 90% savings that's felt by patients off the brand drug if they can get generic. So that's significant savings. Since the beginning of the pandemic, our frontline healthcare workers have used generic medications to treat patients who have come into the hospital and need treatment. Certainly among them are most seriously ill. So everything from muscle relaxants to sedatives, painkillers, steroids that help reduce lung inflammation. These have all been used in hospital settings on COVID patients, and successfully. We've seen mortality rates coming down significantly. And until we have a vaccine, it's going to be treatments like this, generic medications that are being used to treat COVID patients. That's going to get us and be the bridge to the vaccine. Well, the savings overall from generic drugs is significant. It's a large number. Last year alone, $313 billion in savings to the U.S. Healthcare system. That's U.S. taxpayers. In our large government health programs like Medicare saw $100 billion in savings because of generic medications. In the Medicaid program, $50 billion in 2019 alone due to the advent of generic medications. So significant savings to our system, but also to the individual patient. For more information, go to accessiblemeds.org.